I promise this stuff works, and you don't have to go under the knife. Literally, you can do this stuff while you sleep. A tighter neck, more defined jawline, chiseled cheeks, and a younger face overnight. This stuff is going to blow your mind, and it legit works. I didn't discover this stuff, but I figured out that it was working for me by accident. I didn't set out to change my jawline. So what we're going to talk about in this episode are some crazy, simple things that you can do to tighten your jawline. And this stuff is going to blow your mind when you understand the science behind it. It just makes freaking sense. I'm going to talk to you in this episode about your sleep position, how you're breathing, how you're texting, how you're using your phones, your posture, chewing gum, lymphatic massage, and mewing. Have you heard of mewing? We'll talk about that later. And lastly, I'm also going to give you my honest opinion on doing thread lifts, lower face lifts, face tapes, cosmetic surgery, and all the things. All right, thanks for joining me. Let's get to it. So if you're new here, first of all, thank you so much for tuning in. Thanks for checking out this episode of The Chalene Show. I hope you really enjoy it, and I hope that you will subscribe. You will see that I've just done, I think, over 1,000 episodes. Not all of them are on YouTube, but you can find them on any podcast app. I've been doing this for a long time. Yeah, because I've been around for a long time. And because I've been around for a long time, that means things start to sag as you've been around for a long time. Ironically, however, I didn't set out to change my jawline. What was happening for me is tooth decay. Like, I was having so many problems with my teeth. It was ridiculous. I mean, every single time I went to the dentist, from the time I was a child, I would have cavity on top of cavity on top of cavity. And I was a freak about oral hygiene. Like, I was constantly flossing, constantly brushing my teeth. I don't know about you, and please don't take this the wrong way if you're in the dental profession. I mean, we need you, obviously. But I have paid for more than a few dentists' whole entire family and their legacy to go to college in the amount of dental work that I have had to do, like failed root canals. And I swear, I'm like, wait a second, how can I have a cavity? Is that even a real tooth? Like, every single time I went to the dentist, and so many times I would get like infections, and it just didn't really make sense to me until I finally switched dentists. And I had a dentist who said, well, let's, based on your facial structure, based on the fact that you tell me you can't breathe through your nose, this probably has everything to do with the fact that you are a mouth breather. And I'm like, yeah, I'm totally a mouth breather. He's like, well, when you wake up in the morning, like, is your pillow covered in drool? I'm like, yeah, like, I mean, it's embarrassing. It was embarrassing. I always slept with my mouth open. I believed I couldn't breathe through my nose. So he suggested to me at that time that I consider doing mouth taping. And I was like, oh, that makes me sound so claustrophobic. I cannot do it. No, can't do it. So I disregarded his advice there, but he also suggested that I try this mint that you could put in your mouth. You put it like in your mouth between your gum and your cheek. And it just kind of adheres to your gum, and it slowly melts overnight, like very slowly. So it keeps your mouth moist. It also kills bacteria. It's called Xylomelt, and I don't have a discount code or anything like that, but like I lived with those things. Once I started using those, I stopped having tooth problems. I mean, all tooth decay went away. I started waking up with fresh breath. It seemed like it had solved a lot of my problems, but I still couldn't breathe through my nose. And I discovered a podcast I listened to an episode of the Huberman, I think that's how you say it, Huberman podcast, where they were talking about mouth taping.
Because they're not getting rid of CO2.
Yeah.
Oh, wow. So they're literally suffocating in sleep, and you'll see these people, they're mouth breathers. Not even necessarily just people who are overweight. So it's not good to be a mouth breather. Mm-hmm. You don't blow off enough CO2, anxiety goes up.
Yeah, I've heard you should sleep with like athletic tape on your mouth so you train yourself to breathe through your nose, because apparently it's way better for you.
Yeah, I'll do cardio. I do a long run once a week, or some long cardio. I do it. I try not mouth breathe the whole time.
Can it also change face shape?
Yeah, so there's a wild book called Jaws, A Hidden Epidemic, by colleagues of mine at Stanford, and they have these twin studies. One kid grows up in a culture where they eat a lot of soft food, drinking Capri Sun, eating applesauce, baby food. The other one is, got stuck in the jungle or wherever it is and chewing their food. And one kid, these are identical twins, has beautiful jaw structure and high cheekbones, and the eyes look nice and clear. The other kid is like droopy, the teeth are there and their mouth breathing. They show this. There's one case of this young girl who she got a pet hamster, I think it was, allergy to the hamster, and literally took this beautiful young girl, and her face just starts aging at a rapid rate. They get rid of the hamster. She goes back to nasal breathing. They do a little encouragement of nasal breathing using the mouth closure thing at night, do a little bit of medical tape. And like these beautiful, almost like model-esque features come back in this girl. Jaw shape and the clear to the nasal passages. You know, really there's no reason why any of us should ever I had braces, but all your teeth should fit in your mouth, right? And you should be able to put your tongue on the roof of your mouth with your mouth closed. I can't quite do it. Your palate should be somewhat wide. You look at somebody who keeps their facial muscles strong, and this is for women and men, their jaw muscles strong. People who care about their facial structure, especially who don't want, a lot of people are concerned with like, what's going on with my skin? A lot of women and men are like putting all this stuff on to figure out how to get rid of the droopy eyes. It's actually a facial muscle issue, and where they just to do some jaw exercises and focus on not mouth breathing, it completely changes the structure of the face in just 2-3 months.
And there's like skincare salons called like Face Gym and other places where they're literally giving your face a workout, and you'll notice that it's like a lymphatic type of massage. It'll change after one session. So I imagine just doing the training.
And this was known in the 1800s. There was a book called Shut Your Mouth by a British doctor who talked about the fact that people who snore, sleep like this, and then during the daytime they become mouth breathers. He said they become less attractive than the people who are nose breathers.
So then I went on a deep dive and I started listening to other biohackers and experts in this field regarding all of the benefits of breathing through your nose and not your mouth, ever. Like, we're not supposed to breathe through our mouth. Isn't that crazy? And suddenly it made me realize that's why I was always losing my voice. That is why I would struggle sometimes to get enough deep sleep and REM sleep. I think it was impacting my sleep. I think it was impacting so many things that I didn't realize. There's a lot of interesting and compelling research to suggest that mouth breathing may in fact be associated with people who are being diagnosed with ADHD. Interesting, isn't it? Well, so then I was like, all right, I'm going to start mouth taping. So I started mouth taping. And I did that about a year ago. I did a video explaining what my experience was after 30 days. You can check out that video if you're on YouTube, or we will put the link in the show notes if you're listening on a podcast app. And after 30 days, I realized I don't even need to mouth tape anymore. I basically trained myself to keep my mouth closed. I know that sounds crazy, but it was kind of wild. Like, I suddenly started like always sucking my like the saliva out of my mouth and putting my tongue in the roof of my mouth. And I was doing this sucking thing all the time to remind myself to keep my mouth closed, right? And in one of my videos, somebody left a comment and said, "Oh, what you're doing is mewing." And I'm like, "Mewing? What?" I was like, "It's like, how dare you?" Like, I was offended, right? I started doing that like as a habit, and it soon became this constant habit where my mouth was closed and my tongue was in the roof of my mouth and kind of like creating the suction on the roof of my mouth. Okay. Around about that time, what I also discovered was it was really, really hard for me to sleep with my mouth closed if I was sleeping on my side. If I was sleeping on my side, I almost had to have mouth tape on. If I could get myself to sleep on my back, it was almost habitual. Like, while I was sleeping, I would just keep my mouth closed. So I would kind of go back and forth, sometimes sleeping on my back, sometimes sleeping on my side. I think I need to do a whole episode about what it takes to train yourself to sleep on your back. Are you with me? Because I was all my life a side sleeper. And side sleeping just makes your face look older too. Okay, so that's the first thing, is learning to breathe through my nose and not my mouth. It was also my sleep position. When you think about this, so right now, I want you to imagine, in fact, I want you to do this. I want you to stick your head forward as if you have a pillow under your head. Okay, so stick your head forward slightly. Are you doing it? Okay, good. And now turn your head all the way to one side and then stick your head forward. And then imagine that the side that is not near your shoulder, the side that's like facing away, imagine that being smushed, and all of your skin, everything on that side of your face just gets smushed. There's no other way to put it. That's the side of your face when you wake. I promise you this. If we meet in real life and you're a side sleep, just tell me you're a side sleeper and I will be able to tell you what side you sleep on. Start doing this with your friends and family members. You can just tell what side people sleep on because that side of your face tends to be droopier. You'll have a more pronounced jowl on that side. That eye droops a little bit more. It's just, think about it. You're spending 8 hours, hopefully, a day, every single day, 365, smushing your face on that side. It creates asymmetry, and it also creates more swelling. Think about it. So, we have a lymphatic system that has to drain every part of our body. And if one part of our body is smushed, where there's a lot of capillaries, where there's a lot of, this intricate webbing that is our lymphatic system, if you're cutting off the circulation, basically, then your inflammation, your fluids aren't going to drain properly. So they tend to hang heavier on that side. Check it out. Look at yourself in the mirror. Look closely at your partner or someone you know who will tell you what side they sleep on, and you will see, like maybe even that side of the eyebrow is rubbed off, that side of the eyebrow is lower. Like we create this asymmetric face when we're constantly sleeping on one side, not to mention the fact that it is so bad for our posture. Now, imagine if you walked around for 8 hours a day with your head kinked to one side. Well, that's what you're doing basically all night long. And you can imagine all of the imbalances that are created that cause lower back pain and all kinds of, we're a chain. The body is a chain. So when one link is out of place, the whole chain starts to fall apart. So it's crazy how once I started sleeping on my back, the other thing that went away was my shoulder pain. It's crazy. Please let me know. I'm going to pin a comment right at the top of this episode. And I'd love to know, would you like me to do a full-blown episode on how to do mewing, number one? And number two, would you like me to do a deep dive in different sleep positions? Because there is a way to sleep on your side if you just absolutely can't sleep on your back. And there is a way to train yourself to sleep, I think. At least I've figured out a way to train myself to sleep on my back that doesn't involve buying a bunch of expensive pillows. I tried that route. So my sleep position, once I changed my sleep position, it became so much easier for me to, number one, sleep with my mouth closed. That's for me personally. Number two, to feel more rested and not to have the same backache, shoulder aches, all the stuff that goes with having your neck turned to one side for hours and hours and hours. In addition to that, some people, however, will find that when they're sleeping on their back, they tend to snore. And that is because of the position of your tongue. So again, I can do a whole deep dive into that. I'm just telling you that these are the things that dramatically changed the shape of my face. And at first, I thought it was because I was doing lymphatic massage for my face. Okay, so as I started to notice that my face was becoming more defined, I was like, what? That's kind of weird. Because I was watching, no lie, I was watching these plastic surgery videos where they were doing buccal fat removal, and I'm like, maybe I need that. I just look really chubby through my face. It looks like being puffy. And then suddenly I was like, why? That's weird. My face looks like a little bit more pronounced, my jawline started to look more pronounced, my cheekbones started to look more pronounced. I'm like, what is this? And so then because I was doing my research and TikTok, the algorithm is so good that the TikTok algorithm started serving me up videos of people doing face massage, lymphatic face massage with these gua sha stones. And so I bought a gua sha stone and I started doing it, and then I lost my gua sha stone. And I'm like, why do I need a gua sha stone? It's the same thing as using my knuckles. Oh wait, I almost forgot. Okay, you're watching this on YouTube. I love you for that. Don't forget to hit that pinned comment. But most importantly, if you watched to this point, can I ask a favor of you? I'd love for you to subscribe. Listen, you don't have to watch every video, but if you subscribe, at least you've got a better shot of seeing my next episode. And it would really mean the world to me. I really do appreciate that you're here watching. And if this has been valuable to you in any way, please subscribe and hit that notification bell. Okay, I start by taking my index finger and my middle finger and kind of making two knuckles. And I start by going down my nose, the outside of my nose, tracing the outside of my nose. And then I take both my knuckles and I go under the rounds of my cheeks all the way up to my temples, like right above my ears, right? And then I take those 2 knuckles and I come down my neck into my collarbones. And you just do that very lightly. You don't have to press hard at all. I do about 10 strokes going down my nose, under my cheeks, around and down, okay? Just down to the clavicles. And then I take 10 strokes and I start at the middle of my chin. So I have my right hand on the right, left hand on the left, and I just trace my jawline all the way up to my earlobes and then down, up to my earlobes and down. And I do 10, 15, sometimes I do 20. Now, I like to do this with some kind of a serum so it just glides a little bit easier. And I have to tell you, I'm sure I did it wrong. I do everything hyper aggressively. Like when people are like, oh, be gentle on your face. I'm like, I've never been gentle on my face. It's too late. Like when people are like, oh, don't pull, don't tug. I'm like, it's too late. Never been gentle with combing my hair. Nothing about me is gentle. So I probably do it too aggressively. You're supposed to do it like nice and light. But anyways, I kept noticing, okay, my face is getting more defined. And then I posted a video about, doing that technique. And I had a bunch of people who follow me, like maybe you left that comment and said, but Chalene, didn't you also start mouth taping? And I'm like, yeah. And they're like, that changes your facial structure too. I'm like, really? So I'm just going to be honest and tell you, I don't know which one of these things has made the biggest difference, but they've all made a huge difference in the structure and shape of my face and my neck. Like, am I opposed to getting plastic surgery someday? No, but like people are always like, what do you do to keep your neck tight? And let me tell you, I'm 54 years old. So sometimes you open up your camera and you're like, and I will catch like a picture of myself from the side and I'm like, well, whose neck is that? But for the most part, it's pretty dang good. Like, I'm pretty happy with it. And there's going to be a point at which like it's just going to get too wrinkly and crinkly. And when I do a neck lift, sure, I'm all for it. Like, I don't know. I'll look into that. But at the moment, I feel like I've at least prolonged having to do that because this is really keeping things nice and firm and tight. Okay. In addition to that, I started then getting these comments about mewing. And mewing is really, and I can break this down. There's a Dr. Mewing who's really the person who's accredited with developing this technique. And it will blow your mind when you start to look at the research behind keeping your mouth closed, proper tongue position, and how it impacts the width of our jaw, our facial structure, the musculature of our face, and the way all of our face develops. You'll be blown away the story of these identical twins. These twins were raised in different environments, different families. They had different diets. And because of that, one ended up being a mouth breather and one ended up being a nose breather. And you can see the very distinct difference in the way their jaw lines develop. Now, here's some images that are just going to blow your mind of incredible results that people have had in changing and chiseling and defining their jaw. Now, think about it. This is going to make sense to my lady friends out there. You probably know someone, and I think one person I think almost everyone knows is Bethany Frankel, right? So Bethany Frankel had really pronounced muscles right here. And I have had friends who've had really pronounced, like really overly developed jawlines where it's like these muscles got so big that they felt like they looked masculine. And so doctors have been injecting them with Botox, which helps to improve tension there. The muscles start to relax. This tends to happen from people who are clenching their teeth constantly or grinding at night and they don't realize it. And when they give them Botox there, those muscles relax and the face kind of lengthens. Now think about this. And when it comes to muscle, it's use it or lose it. So if you want to improve the size of any muscle, whether it's your bicep or this muscle on your jawline to make your jawline look more defined, then you have to use it in the right way. And one of the ways that you can do this, I know this is going to sound crazy to you, is by chewing gum, but with your mouth closed. Now, there's a lot of evidence to suggest that it's chewing really tough gum, like hard gum, that seems to improve it the best. I don't know if I can go that far. It's interesting. I once heard Oprah Winfrey make a comment about people who chew gum. And like that day, I stopped chewing gum, like just in case someday I would meet Oprah Winfrey. And I was like, I don't want to have that habit, like just in case. But now I'm thinking, sorry, Oprah, I need a jawline. So like just recently, I started chewing gum because I'm like, gosh, if I can stack all of these things and have a younger, more youthful appearance while I sleep without having to go under the knife, without having to do any of these things, I'm going to do it. And it makes a big difference. It makes your cheeks more pronounced. It makes your jawline more defined, in my opinion. Lastly, the other thing you can do, and this one you're not going to do while you're sleeping, this one you need to do while you're awake. And that is be so conscientious of your head position. We have an epidemic of tech neck or geek neck, whatever you want to call it. It's this. How many of you, myself included, find yourself looking down constantly at your phone? You hold your phone. Where do you hold your phone? Do you hold your phone like at just a little bit above your belly button, maybe out in front of you slightly? Like, is that where you hold it? Or do you hold it up a little bit closer to your face? Well, I gotta tell you, I've been trying to hold mine up closer to my face. And I'm trying to get myself in the habit of that by noticing when other people don't do that. And when I look at them and what I do is I zoom in on their neck and I see all these people. Like today, I was at the gym and I looked at the treadmills, and every single person who was on a treadmill or on a bike was also on their phone like this. And it's just not cute. It's tech neck, it's geek neck, whatever you want to call it. But what it's doing is forcing your neck into a compromised position that impinges or affects your posture, that makes you look older, that shortens the muscles, that tightens the muscles at the front of the neck. And these muscles get really super tight, these extensors, I think that's what they're called. And it just makes us look old and tired and melty, like your face is melting into your body. So my recommendation to you is to be aware, where is your laptop? My laptop right now is propped up on a stand. Putting your laptop, whatever tech device you use, and lifting it instead of lowering your head, in the long run, it's going to make a huge difference. And it's a habit, I know, and it's one I think we all can just improve upon. I'm not saying you have to be perfect about this stuff. And they do sell devices. I bought one, and Brett's like, "You're not using that, are you?" I'm like, "Well, it's a wire, like a thick, heavy, moldable tripod that you wear around your neck in front of you, and then it holds your phone for you out in front of your face." Now, I know it sounds ridiculous, but then you don't have to hold the phone. And if you wanted to watch TikToks, or you wanted to get yourself in the habit of positioning your phone in that direction so that your head is in alignment, so that your posture is tall, it might not be a bad thing just to wear around the house. But Brett said, "I can't handle it. Chalene, that is just the dumbest thing I've ever seen." I think it's a really brilliant invention. Will I wear it out in public? Heck no. But it is kind of convenient, especially if you're doing something with your hands. You could literally be watching this on YouTube right now and cooking dinner, and you wouldn't have to hold your phone, and you wouldn't have to look down at your phone, and you wouldn't have tech neck. So how long before you start to see results? Well, it depends. I think everybody's different, right? So it depends. Are you combining all of these things? Do you start chewing gum today? Are you going to begin doing lymphatic massage? Which, by the way, that lymphatic massage treatment that I did to my face, I maybe did that 3 times a week. Now I probably do it twice a week, and I should probably do it every day, but I forget, or I get short on time. So if you were, trying to sleep on your back tonight, if you started mouth taping, and by the way, to figure out how to mouth tape, it's a process. So you can check out the episode where I explain exactly how to do that, the process of teaching yourself how to tape your mouth, what type of tape to use, some better tips in case it makes you very nervous. I cover everything in a previous episode that I'll link in our show notes. It's also here on YouTube. But the mouth tape, let's say you did the mouth taping, you start doing the lymphatic massage to your face a couple times a week. You're sleeping on your back. You start chewing gum. You're remembering to keep your mouth closed all the time, even when you're exercising. And you start lifting your phone up to do your technology. How soon could you see results? Very quickly. I think within a couple of weeks. And of course, genetics has a lot to do with this. But I looked through so many. I looked through probably 7 years worth of YouTube videos to see were people really seeing results from doing these things. And you can, so many people, I wish I had done this, took videos of themselves every single day to see the changes because they wanted to see, is it going to change my neck? Because a lot of people think that they're just born with a bad jawline, no neck, right? And I watched so many videos, and some of these people had results in 14 days, some of them 30 days. My results, I really didn't notice how drastic they were. I mean, I started to notice like subtle changes, but you know, sometimes you think, is that just in my head? I probably noticed subtle changes within, I don't know, maybe a couple of months. But then at a year, I was like, I started looking at videos. I was looking at videos of me talking side by side with newer videos. And I'm like, I look like I had jaw surgery or buccal fat removal. Like, at least I thought so. Maybe you don't see it. I see it. I think it's huge. And so I think you could start to see results very quickly. But here's what I do want to say. Aside from the vanity stuff, and I'm going to share with you my opinions on the whole plastic surgery thing too in just a second. But aside from the whole vanity thing, like when you look at the research on how breathing through your nose dramatically improves your health, it's going to blow your mind. And you're going to be like, why isn't this mandatory? Like, why do we let our kids walk around with their mouths open? Why did anyone let me walk around? Like, I think you're going to save yourself thousands and thousands, in my opinion, not an expert, but I know I am positive, I am convinced anecdotally that I would have saved tens of thousands of dollars. I don't even want to add it up, how many tens of thousands of dollars I would have saved if as a child someone had said, close your mouth. Like we're going to teach you to breathe through your nose. If I had stopped breathing through my mouth constantly and learned to breathe through my nose, I really do think I would have avoided all of those problems. And maybe I would have had a chiseled jaw much sooner. I don't know. So I want you to look into sleeping on your back, and I want you to consider mouth taping. Just consider it. And if nothing else, practice keeping your mouth closed during the day. But what if you're like, Chalene, I am beyond lymphatic massage. My jowls are hanging down onto my clavicles. All of the lymphatic massage and mouth taping is not going to help me get a chiseled jawline. What do I need to do? Okay, well, I will tell you, I bought the tapes from Amazon that you can use. You put them just at your temples, and then it has a very thin elastic band, thin enough that you can hide it under your hairline, and you tape one side of your temple with this very strong tape. Like the soap opera stars have been using this stuff forever. Everyone on TV has been using this stuff forever. I learned about it from a Hollywood makeup artist. So you put the tape on one side of your temple, and then it's got this thin piece of like elastic that you can hide under your hair, and you can pull it over to the other side, and it just kind of pulls everything back, just the way you know, ladies, how we do when we stand in the mirror and we pull everything back, and we're like, yeah, that would be good. Yeah, that's what the tape does. Okay, I bought it. I used it like 3 times, and I was so self-conscious. I was like, I thought everyone could see it. I was like, and I kind of like walked very stiff, because I was like so afraid that my hair would move and people would be like, what is that? But it did make a difference. I was like, and it was so weird. Like when I put it on, we went out to dinner with some friends, and they were like, you look great. I was like, I do? Thank you. But I was too self-conscious, and it's not something that you could do every day. And so if you can't do it every day, you know, and I'm on camera pretty much every day, I'm like, I'm not doing, if I can't do it every day, what's the point? You know what I'm saying? So that, yeah, but the stuff does work. So like if you, I don't know, if there was a special occasion and you're like, I wish I could have a facelift for this weekend, that stuff does work. It really does. Okay, what about threads? You know, you've seen this technique where they're putting threads in the face. Apparently it's, you know, something you can do in office with a plastic surgeon. Not a fan. I did a previous episode with a couple of experts where we talked about threading, and based on their professional opinions, I personally wouldn't do the threading. I've just seen so many complications. Like, just get a lower facelift. Like, if that's what you're considering, and then find a very qualified surgeon. Now, you know, I've done several previous episodes with experts, concierge. Like, these are women who are not paid by the surgeon. They're paid by you to find the most qualified, perfect surgeon for you, because every single doctor has a different aesthetic. You have a different aesthetic in mind. There's a certain bedside manner. There are qualifications and things. You know all the reasons that I say this is one. Unfortunately, this is an area, if you live, in my opinion, in California, New York, Florida, those states in particular, I would not have surgery in any of those states without hiring a third party to help me vet and see, is this surgeon really as qualified as they say they are? Are their reviews legit? How often have they, what is their reputation? Like all of these things. It's so easy for them to hide it, and it's like, it's your friggin' face. So go to the best possible surgeon who's, you just know what you're getting. It's worth every penny that you pay to a consultant, and they're super duper affordable. I will link to both gals' names in our show notes as well. And that's important, okay? Because if you want to get a facelift, get a facelift. Who cares? It's your money, it's your face. Like, it's so funny the way people are weird about that's not aging gracefully. Well, who says you can't, that wanting to improve something means that it's not graceful? If your teeth start to yellow and decay and get small or they're loose, would you be like, how dare you, do something cosmetically for your teeth? You should just age gracefully. I mean, if that's your decision, that's fine. Don't worry about anyone else's judgment. Who cares? If they're not paying for it, then it's none of their business. So you don't have to worry what anyone else thinks. And if it's something that makes you feel amazing, why not do it, girl? Like, you're a girl here, and I know I always get comments. People are like, how can you call yourself a health expert if you do Botox? Well, I do. I love me some Botox, and I haven't had Botox in like 6 months, and I'm going to get some this week, and I can't wait. You know why? Because I will feel like my head feels lighter, and it just makes me feel like more awake. I like it. It puts me in a good mood. It puts me in a good mood when I take a shower. It's like the same thing. It puts me in a good mood when I have a cute outfit on. I'm just zhuzhing things up. And if you don't get that, that's okay, but keep it to yourself, because it's my show and that's what I like to do. Listen, it's your body. You can do whatever you want with it. Just make informed decisions. Please don't do it for other people, but do it for you. That's all I have for you today. However, depending on when you're watching this, on August 10th, I'm doing a masterclass. This is not a free masterclass. This is a masterclass I normally charge $97 for. It's one where I teach people the process of creating multiple streams of income. Like, not how to do all of them, but you've got to start creating extra income at some point, right? And you got to start with one extra stream. Which one do you start with? How do you know when to consider creating or building an additional stream? Like, all of that, I'm going to break that down. I'm going to tell you about our different streams of income and how we got started. That masterclass is normally $97. On August 10th, I'm doing it for $11. So if that's something that you would like to try out, go to chalene.com/masterclass. Again, it's $11 this month if you're catching this before August 10th. If not, just, go to chalene.com, sign up for the newsletter. That way you'll be in the know when I am doing trainings. I do free trainings too sometimes, but I find that when it's something that's really valuable, people show up, because when you pay attention. And these are the kinds of things you need to pay attention to, right? Because freedom and this lifestyle you want to live, let's face it, it's a lot easier if you have financial freedom. And I love helping people understand, what is that process? No gimmicks, no hype, no BS. Really, what does it take? All right, so I hope that you'll be there. In the meantime, thank you for spending this time here with me. I really do appreciate every single one of you. Thank you for taking a second to just review the show. Our reviews have not that they've gotten lower, but people have stopped leaving reviews, I guess, because I've stopped asking for them. So thank you for just taking a moment out of your day to leave a review on whatever podcasting app that you're listening to. And you know what else would be really cool is if you sent this episode to somebody. Send it to your bestie. Just say to your girls, your gays, your guys, you got to listen to this episode. You're going to love it. It's going to snatch your jawline. Send them this episode, because sharing is caring. YouTube family, thanks for liking this video. Thanks for leaving a comment. And most of all, thank you for supporting. Hey, I love you. I mean it. And I'll talk to you soon.